Well, thanks for having me here. So my name is Chaz Smith. I'm the president, CEO, and founder of Be the Change YYC Street Outreach Program here in Calgary. So I experienced homelessness from 05 to 08. And so part of my lived experience kind of fed me into starting Be the Change as I identified a need for outreach services here in Calgary. So for 6 years, Be the Change has been running. We walk the streets, the back alleys. We provide emergency essentials, food, water, clothing, harm reduction, PPE. Throughout the pandemic, we've been scaling up. As a 100% volunteer-run program, we are now 90% volunteer-run program because as the population has become even more complex, we have identified we absolutely need trained staff, which are mostly EMTs, nurses, social workers, community addiction support workers, and most of them are still volunteers at Be the Change. So the pandemic has really changed the scope of homelessness. We know that drop-in services have been extremely limited throughout the pandemic. We've had almost no drop-in services throughout the pandemic where people could simply come in, shower, eat food, do laundry. Finally, last week when the drop-in center announced that at -10, they would allow drop-in services, we finally had some drop-in services that were resuming. The problem is people cannot access emergency shelters for all sorts of reasons. I'll just give you an overscope of Be the Change. So far this year, we have served 15,503 individuals. We've handed out 1,721 referrals to help end the cycle of homelessness. That's to mental health, housing, addictions. And I would just like to say we have no funding from the Calgary Homeless Foundation. What's great is we finally were able to connect with them over the past little bit. And the other outreach programs, as we had a meeting with them last week, are also not funded by the Calgary Homeless Foundation. So throughout that, giving those referrals, on December 2nd, I just want to go to that day, we served 86 individuals. My team lead, Kristen Baraneski, that day, she did a survey of those 86 individuals. 20 individuals participated. So 6 of them said that they would not enter emergency shelters due to theft. 3 said violence. 3 were barred. 1 was a husband and wife who would be separated. 7 said for their mental health, specifically the lack of being able to sleep in a room filled with hundreds of other individuals throughout the night. And when we're talking about complex mental health, you can imagine people have PTSD, there is screaming at night, people fighting, even the odd snoring that happens. I think that we need more drop-in services here in Calgary. We absolutely need warming centers. I identified using trained platforms because we often already have individuals experiencing homelessness at particular platforms. And while we're using law enforcement to try and keep them away, we're actually creating a cycle of trauma and mental health that continues to put a human in a fight or flight mode. So that was my suggestion. As the infrastructure is already there, it would be cost effective. And instead of policing the issue, maybe it's an opportunity where we could actually collaborate and use social workers, outreach workers to engage with this vulnerable population in program referrals also, but while providing a safe place for them to come warm up, safe and accessible throughout the city, as we have many train platforms that are shut down overnight and no one else would be at them. But also there are heated parkades, transit buses when they're shut after hours. There's a whole host of ways that we could provide these emergency warming spaces that are absolutely needed. When we dug into Alberta Health Services records, we saw that 37% of all frostbite discharges in our city were actually people experiencing homelessness. And 50% of the time they were receiving amputations. So as us being frontline outreach workers, we have an obligation to speak for the people that we serve. As a person who did experience homelessness, these are all valuable human lives that have inherent human dignity and potential, just like me. And when we look at these individuals, we have to look at a person who deserves these services and what they truly can be if we give them the opportunity to have them. So thank you for your time.
Thank you, Chaz, for being with us here today. Do I have any questions for this presenter?
Yeah,
Go ahead, Councillor Craw.
thank you. I guess my question for Mr. Smith, and I'm sorry I'm not down there in chambers, is we raised the issue of warming centers surrounding budget, and we're told that work was being rapidly assessed and coming back to us today with this report. Are you comfortable with the direction of this, or do you feel that it is not sufficient to the challenge that's before us today?
I don't think that I think there's a great, it's a good plan. But what I would say is if there's an inherent distrust in the current services that are providing for individuals, I'm not sure that throwing additional funding into those service providers is the answer. I think we need to diversify the sector, and we need to allow people to have more options than just putting them all into one place and having one giant service providing for them. So I would encourage using infrastructure that already exists so that we can create a sustainable model that could be used year after year if we have to, something that's not going to cost us as much tax dollars, but also saving valuable human lives.
Is that a tomorrow issue, though, as opposed to a today issue, which is right before us?
Can you elaborate?
Well, I'm asking, are you comfortable with this plan? You say it's a good plan, but, and then you go on to talk about a diversification of the sector and all of that. And I understand your argument, and I don't disagree with it. I'm just asking, is your but pertinent to what we're deciding today, or is your but in addition to what we're deciding today and something to tackle as we move forward?
I'd like to see how that funding would be distributed. I'd like to see a model of a warming center that could be open very soon, something that can be done quickly. The fact that we're meeting today is great, but we should have been doing this prior to. These agencies have been well in operation and funded for well over a decade. So the fact that it was outreach groups that are primarily volunteer run that are bringing this up, I'm concerned that adding additional funding to programs that clients might not trust might not be the best option. Them saying that they don't recommend using train platforms, I would say, what building would you recommend then? What can we do? Because we have a need and people are dying. We already had an ICU nurse on this call last week, and she said that she just gave an unhoused individual an amputation.
Okay. Thank you for that answer. I will relate those questions to the presenters and to administration. Thank you.
Thank you.
Thanks, Councillor Kura. Councillor Wong, you have questions for presenter?
Thank you, Chair. Chaz, thank you for your story, and thank you for being at the presentation today. You spoke about the barriers to which people are, again, when I say people are both a vulnerable population, but also those that perhaps are unseen and unheard as to why they don't go to some of our shelters and like, for example, breaking up of couples or feeling it's not safe and that. My question is this, in your experience, do you find that this is more germane to the downtown core, or is it spread throughout different extents of Calgary?
Yeah, it is spread throughout Calgary. Primarily, we do see it in the downtown core and Forest Lawn.
Okay. Now, in the extents of Calgary, what would be the mode of transportation for some of these people to get to a downtown warming center, if in desperate situations? It
would be Calgary Transit or Dope Team.
Calgary Transit too, and often, and I'll say quite frankly, I see it quite frequently both in the northwest and the southeast, where whether it's at Markham Mall or down in Chinook or whatever, a lot of people are using the malls as a warming place. But then when the mall doors close, and that getting to downtown may be a difficult situation, whether because they don't have a transit pass or a transit fee to get in there. What would be alternatives for them in neighborhood areas and districts outside of downtown core?
We had identified particular train platforms that we know people often frequent. Like you're saying, Chinook, there's 39th Avenue. Sunridge and Marlborough, where that population often has encampments in that area. So we are seeing that larger population there, which is why my recommendation was to allow after hours that to be a warming center for them, because obviously transportation could as well be an issue.
And again, we hear from Calgary Transit that putting them in our LRT stations may not necessarily be the best place to put them, but yet the barrier in getting there is the transit fare, right? What would be a way which we can get them there, other than a transit fare, other than private vehicle, or whatever? Do you have any suggestions of how we get people to the warming centers?
I would say create an equitable program where this population is already at and make that program accessible there.
So local, neighborhood-based?
Yeah.
Okay, thank you.
Thank you, Councillor Wong. Councillor Pootmans.
Yes, thank you for your presentation. Can you help me? I'm trying to understand the scale and scope of the issue, and the only context I have is I think it was about 4 or 5 years ago, the corporate-led Commission to End Homelessness, which a major capital program to build housing, among other things. How many? At the end of that, I remember what stuck in my mind is that there was some announcement to the effect that homelessness we can call officially over, which was startling in itself, but that furthermore the problems that remained were of a mental health issue of nature, and therefore outside the scope of what that campaign could address. And what I'm trying to understand is, with that context, how many people remain in in those peripheral areas that we're not attracting? You've listed in some detail relatively small numbers. What is the scale of the problem compared to what it was when this problem was supposedly ostensibly addressed?
So what we have seen is we track like what we call rough sleepers, so people that are staying outside versus accessing, and we would traditionally see 70% accessing shelters, whereas now we see 70% outside. So as the Calgary Homeless Foundation is responsible for the PIT count, the point in time count, the 2021 count was actually, I believe, canceled due to COVID policies. So the number that is being reflected here is actually only the count of people that were in those services at that time. So walking the streets, actually talking to people that are sleeping outside, that type of count did not happen that we usually do every 2 years. So this low number that you heard of 1,700, it's nowhere near accurate to what the scope of homelessness is, because we actually did not have the scale of a pit count that we normally would do. So the last accurate one was done in 2018, and that said that we had around 3,000 individuals experiencing homelessness on any night. I would suggest throughout the pandemic, we've seen an upward trend of the individuals we're serving, that it's much higher than that. And how many people are in service? If we were to do a count tonight, you gave somebody, perhaps an earlier presenter, presented accurate single-digit kind of numbers, but what in the aggregate, how many people would be at some point in the system on a given night? I believe that's the number that they stated is that's the amount of people that are in the system, like accessing on that night, that 1,700. That's in service. But then you mentioned there's another population that's ill-defined still. Yeah, which would be the 70% of the rough sleepers. And do we have any sense of what that number would be? We only know the last accurate point in time count, which was done in 2018, and that said we had 3,000. I guess what I'm struggling with is an ask for funding that doesn't include with it an assessment of the population it's going to be serving. And that's just the nature of the beast at this point. Yeah, we didn't have the opportunity to walk the streets to actually do an accurate point in time count. It was shut down due to COVID policy and COVID procedures, which is interesting because our outreach team has been running the entire pandemic serving that exact population. So I think that we probably need to do an accurate point in time count to identify what this total population is. I think the Calgary Homeless Foundation has done great work in the sense that they connected with our outreach teams last week, and they really made clear messaging in their presentation of why people are not accessing emergency shelters. So those were absolutely all the reasons that I heard when I was in the meetings with the other outreach groups and the CHF. Thank you very much. Thank you.
Thank you, Chair.
Thank you, Chaz. I have a couple, just two quick questions for you. Tell me about your group. Where do they operate? In the core? Do they extend outside of the core? What's your reach right now? What does that look like geographically?
So our reach right now is the downtown core. We don't have capacity to expand outside of it unless it's emergency winter response like we did last year, where we were driving around and we were coordinating with other outreach teams to pick different quadrants of the city. And for example, Bear Clan went to the south side of the city, where we went to the north, and we tried to coordinate to the best of our abilities so that we could cover the rough sleepers and provide that emergency response. Most of our funding is private. We do get some city funding, but also people like you that are donating like jackets and gloves. That's what's really powering our groups and other outreach organizations like the ones that we saw in our meetings last week to continue running.
Thanks. You talked about trust amongst our unhoused individuals and the trust that they have with the various organizations and both formal and informal volunteer run combination. In your experience, which organizations have high trust with our unhoused population?
It would be the outreach teams. We aren't treated the same as, the emergency shelters that are, kind of systems that have kind of institutionalized and warehoused people experiencing homelessness. We meet people in an equitable way on their terms as real people. And so when these systems are created that are warehousing people, it creates that inherent distrust.
Okay, thank you for that.